Good evening, everyone. My name is Maya Carter. I am a member of CICE Fellowship Organization for the fall 2023 and spring 2024 academic school year. So I'm just going to go ahead and get started as far as with this presentation video. Overall, I would say I definitely enjoyed my experience with CICE, just working with Miss Dr. Kenya Jones as well as Dr. Giddings and all of my fellow cohort members as well as other social work majors. Excuse me. I feel like despite the meetings that we've had and not really getting to meet each other in person as often as we had wanted, I feel like we all did learn something together, but we also all enjoyed just overall the experience, overall getting to learn more about how to collaborate with other, providers, other mental health professionals, or just overall professionals in general. Um, I feel like I've definitely learned a lot from the meetings that we've had or even the trainings that we've had. I really enjoy being able to speak with or just being able to listen to my previous professor, Dr. Burden, as he taught us about just counseling within the inmate population, um, because that was something that I never really knew much about. But he definitely opened my horizons and taught me a lot more, just as far as how it goes, not only counseling those inmates, but how it can affect us and how the importance of self-care and being able to take care of ourselves, but also being able to listen to Charles Johnson and just talk about his wife Kira and how he fights so hard for Black maternal health, because it's so important. And it was really, not going to say difficult, but very heartwarming just hearing his story and hearing him talk about his wife, and just knowing that he's going to continue this fight for her, because it is very important, especially for us Black women, and being able to have those successful pregnancies and not have to deal with the complications, and just feeling like we matter when it comes to any type of situation, but that specifically. um and overall, all of the, excuse me, I'm not able to remember every single professor or member that we have spoken with, but definitely do appreciate everyone that we've learned a lot from and had the opportunity to speak with, as well as just listen to their stories and listen to what brought them into the profession that they're in right now and why it matters so much to them. Um, I definitely feel like the skills that I've gained, as far as interprofessional collaboration, definitely still even ties into my internship that I was at, Renewed Journey, located in Tucker, Georgia. I had the opportunity and the experience to collaboratively work with other providers and other mental health professionals, um, on a daily basis every single time I was there. At Renewed Journey, we had a team of psychiatrists, we had nurse practitioners, as well as other licensed professional counselors, associate professional counselors. We got social workers. So we all collaboratively work together to just give our clients what they needed, making sure that they got the best treatment that they could. They were effectively treated every single time they met with either one of us, or even if it was both of us, and within that same day. Um, how is the CICE, excuse me, program informed my confidence in advocating for equity and equality in mental health services and access for minority vulnerable populations? Um, like I said, I feel like I definitely learned a lot. For particularly me, I definitely like to work with those minority populations, or just those populations that really don't have the access that they need to mental health services. They're not able to get it, but also just needing that person that when they feel like they're stuck. Um, just overall, I feel like my confidence has definitely grown. I'm still a work in progress, but I definitely feel like I have grown a lot from the beginning, from being in CICE, but also just my overall journey in general. I've definitely developed and I've noticed my growth. Um, And I feel like CICE, excuse me, definitely had a lot to do with it. Um, and I'm very appreciative for them for that. How has the CIC community and our monthly trainings and dialogues contributed to my development? As I stated previously, just being within CICE and getting to speak with Dr. Jones and Dr. Giddings and even Miss Shanika Campbell and all of our presenters that we've had come out, but as well as even with my cohort and working, at my internship, I feel like those interprofessional skills that I've learned have definitely helped me. They've definitely contributed to my growth as a future LPC, as I consider myself still a counselor in training. Um, just being able to learn more about how to go about, really counseling those populations or, different populations and knowing how to, what's the word I'm looking for? I'm sorry. Really just overall knowing what's the best way to treat them, but just also learning more about things that I did not know that's going to help me, like excuse me, referring back to what Dr. Burden taught us, but as well as um what our other presenters have taught us as well, just really learning more, especially in regards to data science and social science. I really didn't know anything about that at all, and that meeting was definitely very informative. It was very interesting, and I feel like the energy within that meeting was just amazing. Um, how did I engage in interprofessional discussions and interventions at my field practicum? Um, so like I said, at Renew Journey, we had a team, a psychiatry team. So I got to work with a psychiatrist, two nurse practitioners, other licensed professional counselors, associate professional counselors, social workers. So in regards to that, especially in regards to if I had a client that also was dealing with or also had medication management, just working or discussing with who their provider was at the time. They would ask me how were things going as far as with counseling, and I would ask them as far as, the client as well as the provider, asking them, how treatment is going, how is medication going. Medication is going good, everything's going good. Is medication, do they feel like it's helping along with the counseling? And if there was ever an issue that may have occurred, whether it's something that they may have told me or something they may have told their other provider, um, we collaborated and figured out what would be the best way moving forward as far as with me counseling them and with them as far as medication management, whether that meant, needing to increase their dosage, decrease their dosage, maybe make some, try other medication, just whatever the case may be. So we continued to work together and always had, discussions as far as what was going to be the best way of continuing to effectively treat our client that we did share. Even with the associate professional counselors, and the LPCs and the social workers, excuse me, licensed social workers or other interns that were also there, we would have group supervision. So we always had a chance to um, talk about, certain clients that we may be having difficulties with, or maybe clients that we may need, other opinions on how to move forward with that client, especially if we're running into a little bit of difficulty about it. But also just that group supervision also allowed us to just learn more. Our supervisor, our director would always have new things to teach us about in regards to whatever age group we may be working with, whatever mental health issue we may be working with. So we always had a chance to just really discuss our own clients clients or just be able to have that learning opportunity as far as, other as far as treatment planning and um setting appropriate goals for those clients, or even just certain other counseling skills that somebody may be having a little difficulty with, just being able to hear from other providers within the site, getting their opinion on, especially someone who may not have difficulty in certain counseling or therapeutic skills, so they can give their feedback as far as what works for them or how they go about it, and that'll help, other providers that may be struggling, if that makes sense. um do I have any feedback for you guys? It would only be positive feedback, and that I really appreciate, everything that you guys have done, not only for me and my cohort, but all the other members of CICE, continuing to have these meetings and have these trainings. And um, even though I wasn't able to attend, even in-person sessions where we could actually come together. I will say I definitely enjoyed the yoga session that we had in the very beginning of CICE for this school year, because I've never done yoga before. So it definitely piqued my interest in wanting to get into yoga now, maybe even try a hot yoga. But I definitely just enjoyed overall the enthusiasm every single session that we had, even though it was a Saturday morning, and we're waking up at 9:30 a.m. and being on a meeting from 9:30 to 12 o'clock noon. But the enthusiasm and the excitement was always there, despite you know and it would help us to build energy up, even if we may be tired. But the energy was always there from everybody, especially you, Dr. Jones. So I definitely just want to say I appreciate every single staff member of CIC. I appreciate everything that you guys have done. I definitely wish I could see who would be involved in it next year, but unfortunately I will not, because I will be graduating this upcoming May. I mean, this upcoming May 18th. So that is all I have. And I'm just gonna go ahead and end it here.